Many people believe all failures are bad, but you may be surprised to know that many of the objects used every day are the result of accidental discoveries. Throughout history, scientific missteps and failures have created the products we can't imagine living without. Penicillin, superglue, chewing gum, and Velcro are among some of the happy accidents. The American Association for the Advancement of Science, or AAAS, hosts the Golden Goose Awards to properly recognize these unplanned achievements.
The Golden Goose Award honors federally funded research that's had an unexpected impact on society. The award was the idea of Congressman Jim Cooper and has been around since 2012. The stories of the Golden Goose Awardees illustrate that scientific research that seems odd or obscure can lead somewhere exciting and even change the world.
That's Erin Heath, Director of Federal Relations at AAAS. Among the 2022 award winners were the inventors of bladeless LASIK eye surgery. This procedure, which has been performed on millions of people, was the product of a lab accident.
Ditao Du was a grad student at the University of Michigan, working with advanced laser technologies. And one evening, he accidentally lifted his goggles while adjusting the mirrors on a laser and caught a stray beam to the eye. Don't worry, he got checked out by a doctor and his eye was fine. And during the medical evaluation, that examining doctor, Ron Kurtz, discovered how precise that lab laser was. This led to a collaboration to test these advanced lasers for eye surgery, and that ultimately led to bladeless LASIK.
Dr. Noel Rose, who's widely regarded as the father of autoimmune disease research, also benefited from what seemed like a mistake.
Rose was working in the lab of his mentor, blood cell expert Ernest Witebski, and he observed something perplexing, that an animal in the lab had developed an immune response to its own tissues. This went against everything that scientists understood at the time. At the time, the scientific consensus was that the body could never react against itself. What ultimately happened is that Rose's observation, which seemed like a mistake, led to the recognition of a whole new category of disease, autoimmune diseases.
Proving that mistakes and failures can be opportunities that lead to incredible achievements. Dr. Jean Carruthers' own observations changed the course of her career. She's a clinical professor of ophthalmology at the University of British Columbia in Vancouver, Canada. 36 years ago, she realized that a highly poisonous biological substance could also be used to prevent wrinkles. It all started when her husband took a job in San Francisco. Carruthers sought out her own fellowship in the area with Dr. Alan Scott, who'd begun using botulinum toxin on patients.
Alan Scott was a genius ophthalmologist who worked in San Francisco at the Smith Kettlewell Institute for Visual Sciences. And he had had this idea with another ophthalmologist called Edward Momini, that maybe what you could do to straighten misaligned eyes, eyes can turn in or out, up or down, or tort. Maybe you could use this as a treatment for misaligned eyes instead of surgery.
Carruthers was excited to begin working with this technique. They used a hollow Teflon-coated needle, which was inserted through the eye back to the motor end plate, which controls muscle contractions. The team soon began using it for other overactive muscles and began treating patients with cervical dystonia. It's a painful condition where the eyes slam shut and the neck, shoulders, and arms contort.
It's a miserable condition to live with. And we thought that this would be the perfect way, because the previous treatment for this awful condition was just surgery. And that was quite debilitating. So we thought, let's treat people with this dystonia, but with the botulinum toxin. And so it was magical because their eyes opened and relaxed. One of my first patients I treated, he was led into the office by the hand by his wife. And 3 days later, after I'd injected him, he sent me a picture of himself driving his red convertible. I mean, it restored people to a normal visual life.
It was one of these patients who gave Carruthers the idea for what we now know as cosmetic Botox.
She said, she was pointing at her eyebrows, "You didn't treat me here." So I apologized, of course, and said, "I'm so sorry, but I didn't think you were spasming there." And here's the immortal line. She said, "I know I'm not spasming there, but every time you treat me there, I get this beautiful, untroubled expression." Now that's the moment. That's the aha moment right there. And I knew how important it was because Alistair, my husband, is a cosmetic dermatologist, and he had been trying with the currently available fillers, collagen, fibril, and fat, autologous fat, to treat the 11s, the frown lines. And he had not been very happy with the aesthetic results. So I said, I think I have an answer for you.
Carruthers and her husband were able to turn this dangerous toxin into a cosmetic procedure that millions of people in America get each year. Heath says these stories prove how our understanding of the world is always evolving.
One of the great things about science is that it's always changing. There's never a point where we know everything. We're always learning. So it's possible for something we believe is wrong at first to be closer to accurate than we thought.
Since Carruthers' discovery, the cosmetic Botox industry has exploded and opened her eyes to a whole new world.
It was a kind of a shock to realize that I'd stepped from one universe into another. And the trouble is, once the horse has left the barn, you can't put the horse back in because you've seen this amazing world. Plus, you realize that at this point in time, which was the late 80s, we are just starting to see the boomers who are now strapped for time. They're strapped for time looking after their own children and their extended family, their parents. More women are working than ever before. More people are starting to think it would be nice if I could do something about my appearance that wasn't a surgery.
And they were also looking for something that didn't require a weekly appointment. Botox seemed to be a great solution. It's a quick injection, and the effects last for months. What was once feared by the public was soon deemed a lunchtime procedure. An entire industry was born from one coincidental observation. Heath says it's a valuable lesson for anyone listening, not just scientists.
Very rarely is the path to success and understanding straightforward. There are always unexpected twists and turns, and scientists and all of us really have to be ready for those twists and turns and see what we can learn from them. Sometimes those twists will provide unexpected insights and take us in a bold, new, exciting direction.
You can find out more information about Erin Heath, Dr. Jean Carruthers, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. This segment is brought to you by Capital One. With one of the best savings rates in America, banking with Capital One is the easiest decision in the history of decisions. That's banking reimagined. What's in your wallet? Terms apply. See CapitalOne.com/bank for details. Capital One N.A., member FDIC. Coming up next week on Radio Health Journal.
The TikTok algorithm, right? It created these categories of the sort of TikTok tics, and there was some kind of modeling effect for these functional tics.
Breaking down the shocking rise of functional tic diagnoses.
Then giving girls the courage to speak out about sexual abuse.
You know what? Incest is the most common sexual abuse, and it is the least discussed.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If we had single teachers, their kids would be on free and reduced lunch because it's hard to make it as a teacher, just a single person on a teaching salary.
The ways in which we're failing the teachers who are shaping the next generation of Americans. Then,
once someone is given that opportunity, they will shine.
The climb to gain recognition as a minority in Hollywood. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.